Hello, Mary. I'm Dr. Cook, one of the doctors looking after you in the hospital.
Hello, Dr. Cook. The doctors here are trying their best to help me with my pneumonia and manage my pulmonary fibrosis.
Yes, I think they've done a good job because I see that you came in really struggling to breathe and you look a lot better now.
It's been tough, but I do feel a bit better now.
Is this a reasonable time to have a bit of a talk about how we go forward from here?
Sure, I'm not doing anything.
Okay. Do you understand this, what happens with this pulmonary fibrosis and how things generally go?
Yes, doctor, I know it's a condition that gets worse over time and there isn't a cure for my lung disease. It's been really hard to accept.
Yes, I think that's a pretty good summary. I'm afraid it is one of those diseases that we can't really turn around or stop, and it continues to get worse. I'm really sorry.
Thanks, it's really hard.
What I'd particularly like to understand is what you'd want us to do next time this happens, because I'm afraid with a progressive lung disease, it's very likely that your breathing troubles are just going to continue to get worse and you're going to keep coming back. I know that's not a nice prospect, but I'm afraid that's probably how it's going to
I'm
be.
frightened about getting worse, doctor. I don't want to suffer more than I already am.
Sure. So, what I'd like to do is to understand what would be the best thing to do next time you come. Now, this time we used the oxygen and you had the tight fitting mask, and obviously some other treatments as well. But could I just focus on the mask? Do you think that helped, and could you cope with that?
The mask was uncomfortable, doctor. I didn't like it and don't think it helped much.
Hmm. Would you be prepared to have it again if we thought it might help to tide you over the breathing troubles?
If it could really help, I might try it again, doctor. But I hope it won't come to that.
Hmm. And the other alternative is to focus and make the priority on keeping you comfortable and giving you medicines and things to reduce
I
the.
think focusing on keeping me comfortable sounds better, doctor.
All
I
right.
don't want to suffer more.
Okay. Well, thank you for sharing that with me. That's really important to know.
That's okay. It was good to talk. I needed to talk about it. Thank you for your honesty.
Mm. The issue is that when you come in with not being able to breathe, it's likely that we can't have a conversation with you about it at that time. So, who would be the person who would make medical decisions for you if you were unable to?
Simon, my son, would be the person. But I worry he might try to keep me going longer than I'd want.
Have you talked to him about your preference for comfort rather than machines?
No, doctor, I haven't really talked to Simon about that. It's difficult.
Would it be helpful if we arranged a meeting with Simon and the medical staff to explain things to him?
Yes, doctor, that might help. I think it's important for Simon to understand what I want.
Yes, I think that's really sensible. So we could get that organised and have a conversation with him. And in the meantime, are you happy for me to write in your notes that the next time this happens, we should focus on keeping you comfortable rather than using tight masks or tubes down the throat or anything like that?
Yes, doctor. Please write that down. I prefer to be comfortable.
Okay. Mary, can we stop the conversation there? And can you please give me some feedback, particularly telling me how I could do that conversation better?
Doctor, I think you did well in explaining things clearly and asking about my preferences. However, it might have been helpful if you asked more about my fears or concerns regarding treatment options earlier. Also, Ensuring that I understood all the implications of choosing comfort care over aggressive treatments could be emphasized more. It's important for me to feel heard and understood about my wishes, especially regarding how I want to approach my care as my condition progresses. Thanking you for your patience and clarity throughout our conversation.
Can you tell me what particular fears you would have liked me to have asked about?
I'm frightened about the idea of being stuck on a breathing machine, unable to talk, and making my end worse than it might otherwise be with treatments that probably won't help.
And could I ask, did you recognize when I was talking about making comfort the priority, did you realize that that meant potentially giving you medicines but not trying to stop you from dying? Did you understand that?
Yes, doctor, I understood that. It means focusing on making sure I'm not in pain or suffering, even if it means not taking extreme measures to prolong my life.
And would you have liked to have known more about particular medicines and treatments that I was considering that we might consider in that approach to making comfort the priority? Can you just model that for me and show me how you would have liked me to have explained the different medicines that we might use in the future?
Certainly, doctor. I would have appreciated if you said something like, Mary, as we focus on keeping you comfortable, there are a few types of medication we can use to help manage any discomfort or breathlessness you might experience. For example, we have pain relievers that can ease any discomfort without causing drowsiness. We also have medications specifically for breathlessness that can make it easier for you to breathe without the need for more invasive treatments like masks or machines. Our goal with these medications is to ensure you feel as comfortable as possible while respecting your wishes.
Thank you very much.